following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University. Welcome to Doctors on Call. Tonight's topic, depression. Two experts are here to answer your questions. Now here's your host, Dr. Raleigh Sullivan.
Good evening. It's normal to feel blue now and then, but when sadness and despair last for weeks and become overwhelming, well, it's time to get help. Up to 40 million Americans suffer with depression. How can you recognize the signs? What causes mental illness? And how is depression treated? We're going to get answers to those questions and more tonight from our two guests, Dr. Derek Mongold, a psychiatrist at West Virginia University whose special interests include geriatric psychiatry, and Dr. Chris Cargile from Texas A&M University who specializes in general psychiatry. If you'd like to ask our guests a question about depression, give us a call. Our phone lines are open now. So I'm going to start with you, Derek. Tell me, let's start off with the basic. What's the difference between having just the blues and something more serious, such as depression?
Well, you're right, Raleigh. You know, it's pretty normal to feel down now and again, especially related to things that are going on around you, the weather. Sometimes in the winter, people get a lot more of the blues. Certain life situations will make them feel a little more with the blues. But when I talk about depression, I use that as a slang term, meaning major depressive disorder generally. There's a lot of different types of depression, but the most common that I talk about would be major depressive disorder. Now, with major depressive disorder, you get other symptoms other than just depressed mood. You also have your sleep being disrupted. Sometimes you can wake up early in the mornings. That's kind of the classic. But I generally see people usually have more trouble falling asleep, staying asleep. They also lose interest in things that they used to enjoy. Some people get some overwhelming guilt. Just anything that happens to them or even around them, they kind of blame themselves and feel guilty over it. It gets to the point that they really start feeling worthless about stuff. Energy will go down. More than just the normal ups and downs you get throughout the day, they'll really have a permanent loss of energy.
Well, I want to come back because I want to talk about, let me make sure that folks understand the blues might be a normal part of human existence.
Absolutely.
But what you're talking about is depression is a much more serious condition. And I do want us to talk some more specifically about the symptoms. I want to get Chris in here. Chris, welcome to West Virginia again.
Good to be here.
You know, it's not uncommon for people suffering with depression to also have other forms of mental illness.
Absolutely. There are a number of disorders, particularly anxiety disorders, that we often see co-occurring with depression. Those two often are seen together and feed off of each other, and often it's very difficult to tell which came first, whether someone has been so chronically anxious to the point that they begin to despair and become depressed as part of the condition, or are depressed and their worry over what they see as a very negative future begins to drive a sense of anxiousness and anxiety all the time. Certainly in bipolar disorder, where we not only see symptoms of depression, but also symptoms that are similar to the opposite of depression, highs when you shouldn't be high, when you shouldn't be as overjoyous as you are, again, are part of really the same disorder. And then there are a whole lot of conditions that occur not necessarily with depression, but can aggravate depression if it exists in a mild form, or can sometimes bring on depression. And we see this a lot in chronic pain. We see this especially in alcoholism and drug abuse. and a number of other chronic medical illnesses. And as we know, most medical illnesses that are chronic tend to make each other worse when there is a flare-up. So.
Yeah. Well, we have our first caller. This is Vicki from Monongalia County, right here at home. Vicki, welcome to the show. You have a question for us?
Yes, hi. I thought I saw in one of the doctor shows that there was a test that can be done, like an MRI or something, that the part of the brain where depression shows up would show up different colors to let you know what drug is suited for whatever kind of depression you have, or something like that. I don't know if I misunderstood or is there something like that?
Well, I think we all understand what she's talking about. Who wants to take a shot at that?
I can talk about it for a second. There are some scans that will show differences in the brain, but really that's more experimental. Generally, they take people that we know have major depressive disorder. You know, to diagnose major depressive disorder, there's really no test or scan. It's more of a clinical interview, talking to people and having some of the symptoms of depression, not just the depressed mood, but the other physical symptoms that you get. Then they take those people and do the studies on them. They can see that some people, when they respond to medications, there'll be changes in their brain. Now, the exact same changes happen with therapy or anything that really gets the depression better. But those aren't really nearly as sensitive as the actual clinical interview. The best way to diagnose depression is talking to a psychiatrist or an expert in the area.
Anything you want to add to that? I was, just thinking that we're a long way, really, to kind of answer her question maybe even more directly, we're a long way from being able to look at a scan or some kind of brain test and predict what kind of medication the patient might need. That certainly would be a hope, I guess, for the future. Right?
Absolutely, and I think those types of scans, the more sensitive they become, I think that's really the hope. Currently, the sensitivity is not there to clearly distinguish depression, even from at times patients just with the blues or that are having a very sad event, but not necessarily clinical depression. Just not quite there yet with the sensitivity.
We have another caller. This is Kathy from Martin County, Kentucky. Kathy, welcome to the show. You have a question for us?
Yes, I'd like to know what causes a chemical imbalance.
Chemical imbalance, that's a good question. That comes up all the time. Who wants to take that? Okay.
Well, we know that the brain functions on a number of neurochemicals. We also know that in depression, there are some changes that occur in certain types of neurochemicals that are involved in clinical depression. Even what those are exactly is a little unclear. The most we really can tell about it comes from the types of treatment that we know to be effective. So we do know that certain chemicals, if we can change them in slight ways using medication, or actually make the same types of changes in the brain using talk therapy, we know there's improvement. So from the fact that we get change, we get improvement by changing the balance of those neurochemicals, we back into the assumption that there are changes in those neurochemicals that are involved in the actual disease state or the cause to begin with.
Unfortunately, we do have some medications now that are actually really pretty good at helping people with depression, sort of these chemical imbalances. One of you all want to talk about that, some of the medications we have? Maybe start with the SSRIs, which are kind of the most well-known.
Yep. So right now we use mostly the SSRI medications. Such as Prozac. That's the most common one. A lot of people have heard of Prozac. Still a very good medication. I use it very often. I think it's one of the best medications that we have. Has a lot of evidence behind it. It increases one of the chemicals in the brain called serotonin. There's also a newer class of medications coming out that actually mimics our older class of medicine. The newer class of medicine increases two different chemicals in the brain, serotonin and norepinephrine, which is also what happened with our older classes of medications, two older classes of medications, the TCAs and the MAOIs. There's a few other antidepressants that work in different ways. One increases dopamine, and some others kind of modulate the serotonin and norepinephrine, but really it's those three chemicals that we're trying to target with
serotonin, norepinephrine, and dopamine. That's probably about as many chemical names as the audience would want to hear, but those are the ones, I suppose, that are involved in depression. We have Anita from Logan County, West Virginia. Anita, welcome to Doctors on Call. You have a question for us?
Yes, I've been several years. I went into depression, but I got hurt in '09, and I've had chronic pain since. I can't drive, and it's just severe pain. And now I started with severe panic attacks. I've been on medication, several different kinds, and it just does not help the panic attacks. I've even been hospitalized, and I just wondered what would help panic attacks. I mean, it comes in the middle of the night, it comes all during the day, and they're coming closer and harder to come out of.
So you have chronic pain and depression and panic, and what medicines are you on now?
Vibrant is the new one that's out. Let me give you the name of it. I can give you several ones that I'm on. And, I mean, it masks it a little bit, but it doesn't help a lot with the panic attack. In fact, I even had to see a heart specialist, and that's what he came out with chronic pain and panic attack.
Okay.
Because my heart...
How old are you?
42.
42. Who would like to try to help her with that? I know you're interested in pain and depression.
I do. We never know what comes first. Usually people will develop a chronic pain syndrome first, and then they become depressed. We think, maybe because of the pain, but one thing that we notice is when people do become depressed, their pain becomes a lot worse. Not even just the physical feelings of pain, but the way they deal with the pain. They really can't tolerate it, can't handle it, can't deal with it very well. And then other symptoms do come on, like panic attacks. You're right, medications can help some, and we like to start with medications. The other thing that I recommend for people who have chronic pain and depression with other symptoms is psychotherapy, especially one type of psychotherapy called CBT. That really seems to help people not necessarily get out of the pain, but deal with the pain better. They might feel the same amount of pain, but they can go out, they can do things, they enjoy their life despite having the pain instead of getting completely rid of the pain. Yeah. And that really seems to help people.
Let me ask before we take our next question, are there some medications in this particular patient's case that should be avoided if you have pain and panic and depression?
There are. One type of medication we're seeing a lot, the benzodiazepines, like Xanax or Valium, people use those a lot for panic attacks, which is kind of a short-term solution for a long-term problem. People, it works very well, but what happens is when you use medication to kind of escape from the panic attacks, it makes your body more likely to have more panic attacks down the road. You'll notice the panic attacks start coming closer and closer and becoming more intense when you have them. Those sort of medications are good if you had a problem that was only going to last for a couple weeks, but usually panic attacks are something that lasts a good bit longer, a couple months. The other big thing we're seeing in West Virginia, there's a huge increase in deaths of people mixing the benzodiazepines like Xanax with certain types of pain medications, the opioid pain medications.
It's a big problem, West Virginia. Anything you want to add to that, Chris? Okay. Let's get on to our next caller. This is Paula from Berkeley County, West Virginia. Paula, welcome to the show. And do you have a question for us?
Well, I do. I'm 58 years old. I worked 30 years in a factory and had pretty good health and everything. And they downsized us and my job was over. So I got a job working at First Data in Hagerstown where I take oncoming calls. I've been there 6 years. After my first 2 years, I developed diabetes. And I think it's mostly because of lack of exercise plus stress. It is a very stressful job where you're working with merchants. You never know what's going to happen. Plus, you're getting monitored also. Then I developed anxiety and depression. And I had a doctor that prescribed me Xanax. For like 5 years, I took that, and I did okay. Now I've got to give myself shots of insulin, and I've got to take insulin medication. And I'm still going on a yo-yo pattern, trying to keep my sugar stabilized. I'm having trouble keeping it below 200. I just started seeing a psychiatrist who is prescribing me Wellbutrin. It doesn't seem to be helping me any as far as the depression, the anxiety. I really don't think that I need the Xanax anymore. I went for a year without it, and he prescribed it to me again, but it's like I don't need it. It doesn't help. But my biggest concern is I cannot quit my job because I would not have any health insurance or an income. And right now I'm living paycheck to paycheck. And that's anxiety on itself right there. What do I do?
So your big concern is anxiety and the fact that you need to work, and are you on the right medications? Well, how would you guys like to handle that? What would you like to say?
Well, I think we've hit on several things that I think apply here, and several things that Derek had mentioned earlier, just talking about chronic pain and depression. The same things can often be said of many chronic illnesses and depression, especially with insulin-dependent diabetes. Blood sugar changes can trigger anxiety attacks about as much as any other general medical illness we know of. If your blood sugar's too high, it can make you anxious. If it gets too low, it obviously makes you anxious. So those are very difficult to treat unless it's very much in a combined treatment where there's as much intensity on the control of the blood sugar as on the anxiety. Now, sort of approaching the anxiety, assuming, we're doing everything we can for the blood sugar. There are a number of different things, as Derek talked about, beyond benzodiazepines, beyond medicines like Xanax and Valium, that can be helpful in anxiety. And I think it doesn't sound like, all of those have been explored yet. A lot of the antidepressants, particularly the ones that are involved in changing levels of serotonin and norepinephrine, like we talked about earlier, work very well for anxiety. Wellbutrin is usually not one of those. It may be something. What I usually tell people is if things aren't getting better, get back to your doctor. Let your doctor know that things aren't getting better. We are usually our own best advocate for our health care. And, I encourage people to, get in there and describe to their doctor, we've given this a good try. I'm still not any better. What's the next step?
Yeah, it sounds like she has a family doctor and internist as well as a psychiatrist, and that she just needs to hang in there and make sure that they know how she's feeling and keep working with her. And I suspect that she'll get better. I mean, that's the good news about this. Let's go. We have another question. Let's see. This is Crystal. Crystal from Marion County. Crystal, welcome to the show. You have a question for us?
Yes, sir. I'm having a hard time. I lost my mother about almost 2 months ago, and I've just been grieving myself to death, and it's been really hard on me, and I don't know what to do.
How old are you?
I'm 46.
Okay. Are you having problems sleeping or eating or?
I was sleeping, and I just want to sleep all the time, and I just don't want to go on, and I just don't feel like myself. I don't feel normal anymore.
Have you had any treatment?
Yeah, I go to the doctor. I went 10 days and 10 nights. I didn't get any sleep whatsoever. They put me on some medication, and I'm just still grieving myself, and I don't know what to do.
Okay.
I feel at a loss.
And how long have you been on the medication?
Well, I take Xanax for my nerves, and then I'm on Celexa. Yeah, I take that at night for bedtime, and it's not helping me. And I just don't know what to do. I just cry every day, and I'm grieving myself.
Okay.
And I know life goes on, and I just don't know what to do.
Yeah, this is a tough case, but this lady, what do you all recommend?
Well, this is kind of a little bit of a tricky case because her mom died so recently. You know, grief can often look like depression. Sometimes even the experts have trouble telling the difference. Really, the big thing that that makes me think this is more than grief in this, or when this happens, something like you start thinking you'd be better off dead, wishing you were dead, crying all the time. It's fairly normal to cry, you know, if your parents die, but crying all the time, that does become a problem. Now, we don't, or we let people, if they grieve for up to 6 months, we can even call that normal. It's after that we start to think that this is abnormal, unless we have some of the symptoms that I was talking about earlier, some of the more severe symptoms.
Well, and she said she didn't want to get out. Apparently she doesn't sleep, doesn't want to get out of bed, doesn't want to do anything.
Which are some of those more severe symptoms?
So she's on, I think, Celexa and, what'd you say, Xanax?
Celexa and Xanax. Now, one thing about the Celexa to talk about is that medication doesn't really kick in and start working for about a month. It'll take a month. She said her mom died 2 months ago. It's hard to say if this medication has had time to really kick in and start working unless she started taking it right away.
Yeah, I mean, that's one of the difficult things with treating depression is the fact that our antidepressants take at least 4 weeks to kick in, and some studies show as many as 8 weeks before they're doing everything they're going to do. So it's really important in that short term that patients are in contact with their doctor, have identified family and friends that they can use for support, talk to, lean on, and to keep them aware of how they're doing. So if things get worse, you can begin to consider hospitalization if that's necessary until the medication has had its chance to do its thing and get you feeling better.
Yeah, well, that's what I was concerned about. If she's feeling so desperate, I want to make sure that she realizes if she does get that bad, she can go to the hospital. We can certainly get treatment for her. You know, she doesn't have to feel so desperate. The next caller is Justin from Nicholas County. Justin, welcome to Doctors on Call. You have a question for us?
Yeah, I recently went through a couple of things in my personal life that made me feel really depressed, and it seems to be that as time goes by and I try to get over it and trying to resort to those things that can clear your mind often make me feel worse, like I almost feel a sense of guilt, like I'm trying to move on, like I gave up on the reasons that I mentioned before in my personal life, and I don't know really how I would go upon clearing my mind for things like that and not feeling so bad about everything. I just don't know if you guys would have any advice on that.
Are you on any treatments? Are you getting any treatments now?
No.
So you've been sort of dealing with this depression on your own?
Yeah, I've always been somewhat like to try to cope with things, but like I said, lately I try to cope with things in my own way, and it almost gives me this very strong sense of guilt, like I give up on things, and it makes me feel worse. The things that I normally turn to make me feel better make me feel worse.
So you feel guilt and I guess a little hopelessness then too.
Yeah.
How old are you?
24.
24. Okay.
Like I said earlier, I think that guilt is one of the warning signs that this is more than just the blues, that this is something such as a depression. That would be a sign that you should see your family doctor or even a psychiatrist to see about getting an evaluation to see if this is more than just the blues and maybe trying a medication for this.
Yeah, he said he sounded like he was ashamed of what was going on. And you know, I think one of the things we could talk about is, you know, well, let me let one of you two talk about it, shame and depression. A lot of people may feel this.
Absolutely. You know, I think, and maybe even in this case that we just heard, you know, there's this sense of confusion about why you're feeling guilty, why you're having these thoughts, when part of your brain is telling you that's not the way to think, that you shouldn't be thinking that way, but yet you have these feelings, and you should feel better, and yet you're not. And what I tell a lot of patients is that in many ways depression is a delusional disorder. It's your brain telling you things are different than they are, that you should feel guilty when part of you knows you shouldn't. There's nothing to feel guilty about. When your brain telling you that things are going to get worse when you know at one level they're not. And it's not something to feel ashamed about. It's a medical condition that you didn't ask for,
Right.
that comes on just like diabetes, high blood pressure, hair loss.
Hair loss. And what should he do?
Well, again, I think it's a very good point. If I mean, this sounds like a very different place than he normally is when under stress. I would go see your doctor. Again, a family doctor is a good place to start. One, they can help define whether or not it's depression, and two, help guide you in a direction for other kinds of care.
Don't want to cut you off, but we're going to run out of time. I think that was good advice. See your doctor. Well, we've been talking about depression with Dr. Derek Mongold of WVU and Dr. Chris Cargile of Texas A&M. I want to thank both of you for being with us. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. Raleigh Sullivan. Good night and good health.
Join us again next week for an encore presentation of Doctors on Call. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.